Hello, everybody. Welcome to your in-service. This one is on professional boundaries. So I'm going to share my screen with you. You'll see the PowerPoint, which I'm going to email to all of you. And there's going to be a small 10-question post-test. If you would please complete the post-test, I'll send a sign-in sheet, send them back to me to verify that you watched it and that you understood it. And there's your education for it this month. Okay, ready? Let's go. I'm going to share my screen. And professional boundaries. So what does that mean? What are professional boundaries? So professional client relationship is defined by boundaries. So that means, there are limits for a safe connection between you and your patient. And it's always based on your patient's needs, not wants. And I'm going to explain what that really means, because a patient may say to you, oh, tell me about yourself. Tell me about your kids. Do you have kids? So they really don't need to hear about your personal business, even though they may ask. So we're going to talk about ways to, kind of divert that. Professional boundaries should be mutually understood, and there should be limits of relationships between patients and clinicians and caregivers in general. So it's important. Why do we need boundaries? Well, we have to be able to have some kind of limitations to direct the relationships that we have with patients and their families to protect us, to protect the family, and to protect our organization. So the first and most important thing that you have to do when you interact with your patient and their family is remembering that there are these guidelines for boundaries. And that is the foundation of a therapeutic relationship. You would never date your doctor, hopefully. So, it's really important to remember these guidelines when you're dealing with clients. Okay. So here's a little table, and this is understanding the difference between personal versus professional relationships to avoid having violations, right? So, length of a relationship. In a professional relationship, it's usually time limited based on the need for services. So in other words, if we're providing care for this person and their family, then once they don't need the care anymore, the relationship terminates. A personal relationship can last forever, lifetime. Where is the relationship, the location? So place is defined, could be a facility, could be the patient's home in our case, but it's defined, right? In a personal relationship, it's undefined. Purpose of a relationship. Well, in a professional relationship, the goal is to provide care, services, right? Meet the needs of the patient. A personal relationship is all about, personal interests and pleasures, right? The structure of the relationship. The structure is to meet the medical, psychosocial, and spiritual needs of the patient. Well, the structure of a personal relationship is spontaneous. It's really unstructured. Power balance. And this one's important. They're all important, but this one's really important. The power balance in a professional relationship is unequal from the beginning because a clinician has more knowledge and power than a patient and family. Whereas in a personal relationship, it's pretty much equal. Should be anyway. The responsibility of the relationship boundaries are on the clinician. Okay. In a personal relationship, it's equal. Both parties are responsible. The relationship preparation, basically, it's on the clinician because we train you. You've had other training before as well. And it's important that that training extrapolates into your care to your patient. In a personal relationship, there's no training for that. Sometimes we wish there was. And then time spent in the relationship. In a professional relationship, it's an employment agreement with the organization. So this is your patient because you work for NJ Health and you're seeing the patient because of us. In a personal relationship, there's your own personal choice about time and how much time is spent. So what is a violation? So boundary violations occur when you place your needs above the patient's needs and you gain something, but at the patient's expense. Boundary violations often appear pretty innocent to start out with. They can actually be less innocent as time goes on. And because of the nature and the circumstance of hospice, it's easy to cross the line. It is, I understand, because we feel this closeness, but it's not the closeness that we would have in a personal relationship. Okay. So what are the common violations? Self-disclosure. I'm going through a divorce right now. The client doesn't need to hear that. Right? Grieving or giving or receiving significant gifts. There will be times where a family member will say, you're so good to my mom, here, Christmas, $50. That's a significant gift and you're not permitted to accept it. Overlapping relationships. What does that mean? That means that, your relationship is a caregiver to a client and family. If that somehow overlaps into a personal relationship, that's a problem. Becoming friends. They can't be your friends. And then the last one, heaven forbid, having a romantic relationship with either a patient, a family member, caregiver, someone that you met through the case. Don't do that. So here's some questions you can ask yourself. If you're wondering, is this appropriate? Is this therapeutic? So does this patient mean something special to me over and above others? Am I treating this patient or their family differently than I treat others? Is there something special about this patient, right? Is this or what I'm doing in the family or the patient's best interest? Whose needs are being served in this relationship? And would you want other people to know that you engaged in this, whatever the behavior is, with a family member or a patient? And then, of course, am I taking advantage of the vulnerability of this patient or family member? Some questions that you would ask yourself. You would also say to yourself, could I discuss the interaction I have with this family and patient with the members of the IDT? If this patient interaction made the headline news, right, in a newspaper or on social media, would that be okay with me, my supervisor, and the administrator? Am I doing whatever this behavior is because it's the best thing for the patient or because it's satisfying to me? Is it more important that I do this for the patient, or can it be done by others in the organization? Right? These are important questions to ask yourself. And could I document this interaction in the patient's medical record without any consequences? So there are some behaviors that are common that can lead to these crossings of boundaries and violations. So don't interact with patients outside of regular work hours. They shouldn't have your personal phone number. You should never withhold any information or any aspect of a patient interaction from the other members of our team. You should never help the patient or family in areas outside of your job description, okay? You can't be driving the caregiver to the store. That's a big liability too, very huge. You should never share personal information about yourself, your cell phone number, family information, right? Excessive self-disclosure, kids, divorce, whatever's going on in your life. And then the giving and receiving of gifts, like we spoke about before. So a professional boundary defines that relationship that supports a therapeutic connection between us and the patients. The zone of helpfulness constitutes the center of the continuum of recommended professional behaviors. So you're going to see, I'm going to show you a little Venn diagram, rather. It's going to show you what the zone is. So you can be under-involved, over-involved, or just therapeutically involved. So this is what we mean, right? The zone of helpfulness is right there in the middle, where we're doing, what we need to do, what we should be doing to the best of our ability to help this client and their family. We should never be over or under involved. Okay. So, because when we do, you see that crossover where we're outside that zone of helpfulness and we're into these dangerous territories that are either over or under involved. Okay. So what do? Treat everyone at all times the same, with dignity and with respect, the way you would want to be treated. Inspire confidence in all your patients by speaking, acting, and dressing professionally. That's important. Through your example, you motivate the people that you work with to talk about and treat patients and their families with respect. Live what you do. Be fair and consistent with every patient, and that will inspire trust, amplify your professionalism, and it also enhances your credibility. right? So when you're giving any type of professional advice, if you're a nurse, if you're a home health aide, whenever you're, saying, listen, I'm going to move you this way and here's why, they'll take you as knowing what you're talking about if you maintain professionalism. Avoid discussing personal issues with clients, please. Don't ever keep a secret that's just between you and the patient, right? Or keep a secret for the patient. Understand that none of us are indispensable. You are not a super clinician or the only one who really understands or can help this patient, right? We all work as a team. You can't spend additional time with any one person that's showing favoritism or revisiting that patient when you're not working. You can't ever engage in behavior that somehow could be misinterpreted as like flirting, okay? And when there's a disagreement in the family, if anything's going on, if there's family conflict, that's when you contact the nurse case manager, social services. You don't get involved or take a patient's side ever, right? So, respect their differences, cultural, religious. Never accept an invitation to a party or a social event, right? Don't accept gifts. Of course, never engage in any kind of touching that could be suggestive. A nice hand on a shoulder, a warmth, that's fine, but that's the limit. And don't ever use gestures or tone of voice or expressions that could be interpreted or misinterpreted as being like seductive or God forbid, abusive. Okay, very, very important. So summarize what we talked about. The number one thing I think to remember is that it's very easy to fall into that tripping over the zones, right? And disclosing information about yourself. Tell me about your kids. Oh, why were you late today? Oh, well, my car broke down. It's easy. You have to constantly remind yourself that it's not professional to disclose this information. If they ask about your kids, a great thing you can do is, yeah, I got 3 kids. Tell me about your kids. Do you have kids? Grandkids? Turn the conversation back to them. Okay. Always, remember that establishing those boundaries and maintaining them, it's essential. It's essential. It's essential to your licensure, to your professionalism, and to providing good care for your patients. Always be on top of it. Monitor your relationships with your patients and families. Make sure there's no warning sign. Maybe you're stepping over the line a little bit. Always disengage from any situation where a boundary could be violated. Remember, boundaries are really necessary to ensure a secure therapeutic environment. Everyone needs mutual respect and dignity. You don't ever, ever, ever want to cross that boundary because it leads into dangerous territory. Okay, so that's the end. This was a pretty quick one. I'm going to send you guys the sign-in sheet and the post test. And if you have questions, you can always direct them to me. And I hope you enjoyed this presentation. And we'll see you again for the next presentation. All right. Thanks. Have a great day. Bye-bye.